Hi, I'm Dr. Mira. Clear, calm, and science smart. Take a breath, let's begin. Hello everyone, I am Dermatologist Mira, here to guide you calmly and warmly to support your skin health. Today we will spend time together with a deep and practical conversation for older adults in their 70s. Our themes are the medical causes and differences between age spots and melasma, the cautions about risky home remedies that people follow without thinking, the pros and cons of treatments you can receive at a clinic, 3 gentle masks you can try comfortably at home, and a food guide you can practice at your table each day. Please relax and walk with me at an easy pace. First, let us understand the basics of mature skin. As we age, the skin becomes thinner and drier. Production of collagen and elastin slows down and the barrier weakens, so the skin becomes vulnerable to external irritation. Skin that has received a great deal of sunlight carries that record, and we call this photoaging. Long accumulated ultraviolet light stimulates pigment cells, so color can gather in spots and elasticity falls, which leads to fine lines and sagging. When you hold this background in mind, it becomes easier to see why age spots and melasma appear and to tell them apart. Now let us look at the differences. Age spots are often described as seborrheic keratoses or as solar lentigines when they are related to sunlight. On the surface, the borders look rather distinct, and the color ranges from light brown to very dark, and the spots can be flat or slightly raised with a rough feel. They often show up where photoaging has built up for many years, such as the face, the backs of the hands, and the arms that meet the sun. Because skin cells locally overgrow and keratin thickens, you can often feel texture with your fingertips. Melasma is different. It usually appears as soft patches around the cheekbones, the forehead, and the upper lip, often on both sides in a similar pattern. When you touch the skin, it feels flat, and the edges are blurred rather than sharp. Melasma reacts sensitively to sunlight and heat, and it also relates to female hormones. It may deepen after pregnancy, and it can be influenced by sudden stress, poor sleep, and warmth in daily life. Strong heat and strong ultraviolet light can make it worse. In short, age spots tend to be rough with clearer borders, and they arise where the sun's record is thick and hard. Melasma is more like a soft spread of color that comes from extra production and uneven distribution of melanin inside the skin. This distinction matters because the care is different. Age spots have a keratotic surface change, so mechanical removal or laser can be relatively straightforward after proper diagnosis. Melasma is intertwined with melanin production and vascular reactivity inside the skin, so it needs gentle long-term management rather than aggressive actions. Knowing this helps you avoid unnecessary irritation and choose a direction that truly suits you. Next, let us talk about popular home remedies. Some people apply sour liquids with a cotton tip and rub a dark spot or leave it on for a long time hoping it will fade. Others try an alkaline powder mixed with water and spread it on the marks. These methods are risky. Strongly acidic liquids can rapidly break the skin barrier. Strongly alkaline powders disrupt the healthy, mildly acidic shield of the outer layer. Both can cause redness, stinging, and soreness, and in severe cases chemical burns that leave darker pigmentation or scarring. In older skin, which is thin and slower to recover, even small irritation can linger for a long time. If your skin feels hot or begins to peel, it is a sign the barrier is already damaged. Another problem is that these methods act unevenly. When you apply strong acid or alkali on an irregular surface, some areas are over-damaged while others do not change at all, so blotches can look more obvious. It is safer to avoid such do-it-yourself attempts at home. The core is to reduce irritation, protect the barrier, and practice steady moisturizing and sun protection. Now let us review treatments at a clinic. First, age spots. When the surface is raised and keratotic, a clinician may choose cryotherapy, electrosurgery, or laser resurfacing after diagnosis. The advantage is that results can be visible relatively quickly. The trade-offs include temporary redness, itch, or crust, and in rare cases post-inflammatory, darkening, or lightening. During healing, strict sun protection and moisturizing are essential. If you have diabetes or take blood thinners, you should discuss this in detail with your clinician before any procedure. Now melasma. If laser energy is too strong, melasma can actually darken, so a careful approach is needed. People often use brightening creams or gentle acidic skincare over time. Low-energy laser toning or light-based treatments can be done at intervals. This is combined with habits that calm, heat, and protect from light. The benefit is a softer, brighter tone and smoother texture. The trade-off is that it takes time and patience and may respond again to sun and heat. Wide-brimmed hats, physical shade, and daily sunscreen are central. Some ingredients are limited during pregnancy or nursing, so follow professional guidance. Let us introduce 3 gentle masks you can use at home. Our focus is minimal irritation with moisture and barrier support. When trying a new mask, first place a small amount on the inner arm and check for comfort before using it on the face. If your skin is sensitive, there is a wound, or you have just had a procedure, please wait until the skin has fully recovered. First, a perilla oil mask. After cleansing while the face is still lightly damp, warm a tiny amount of perilla oil between your palms. Spread a thin veil over the cheeks, the forehead, and the jawline. Start with a very small amount so it does not feel greasy. Target only the dry areas if you prefer. At the end, cup your face gently with your palms to help absorption. Use it in the early evening so the skin can breathe, and before bed lightly wipe or rinse off any residue. If the scent is strong for you, mix a very small amount with a familiar moisturizer. Second, a perilla seed powder mask. Use finely milled powder. Add lukewarm water little by little until it holds its shape and does not run. Keep the texture on the thicker side to avoid friction. After cleansing, apply a thin, even layer, avoiding the eyes and lips. Leave it for a short while, then rinse gently with lukewarm water and finish with generous moisture. This can help when flaky patches feel obvious but do not rub the skin. If there is tightness or redness, stop and simply moisturize. Third, a rice flour brightening mask. This name reflects a calm and clear tone as a goal. Combine finely milled rice flour with lukewarm milk or water to a soft cream. Spread a thin layer on the face. Rice flour helps settle, lifting flakes and milk proteins. Add comfortable hydration. Do not rub. After a set time, rinse well with lukewarm water and seal with a hydrating cream. If milk does not suit you, use water only. Keep these shared rules for all 3 masks. Reduce irritation, avoid rubbing or scrubbing after each mask. Apply enough moisturizer and use sun protection during the day. Sunlight can undo your careful work. Let us build a food guide for healthy skin. Skin reflects the inner state of the body. Balanced meals matter most. Rather than expecting miracles from one special item in a short time, build small choices each day. Drink water regularly in small sips. Eat a variety of colorful vegetables and fruits. Deep green leafy vegetables and orange-toned vegetables and red fruits such as berries and tomatoes offer helpful antioxidants. Include good quality protein. Fish eggs, beans, and tofu provide building blocks for repair and collagen. Balance healthy fats. Perilla, sesame nuts, and olive oil support the moisture barrier, while overly rich foods and added sugars can worsen oiliness and inflammation, so moderation helps. Support gut comfort. Yogurt and traditional fermented foods can improve the intestinal environment, and that often shows on the skin. Keep caffeine and alcohol in check since they can steal body water and disturb sleep, which slows repair. Lifestyle habits shape the skin. Sun protection is needed in every season. Outdoors, wear a wide brim hat and protective glasses and choose shade as a habit. Even indoors, when you sit by a window for a long time, consider protection. Sleep is the time for recovery. Keep a regular bedtime and wake time so your body rhythm rests in balance. Stress management matters. Gentle walks, light stretching, and calm breathing can ease heat and tension in the face. Wash the face softly rather than excessively. Harsh cleansers and repeated washing cause tightness, redness, and barrier damage. Use lukewarm water and a mild cleanser, and apply moisturizer right away after cleansing. Let us pause and summarize. Age spots are rougher with clearer borders and often form on areas with deep sun history. Melasma is blurred at the edges and spreads softly and reacts to sun, heat, hormones, and habits. Do not apply strong kitchen acids or alkaline powders to the face, as they can damage the barrier and worsen pigmentation. Clinic care can be immediate for age spots, while melasma requires gentle long-range management. At home, you can carefully try perilla oil masks, perilla seed powder masks, and rice flour masks with a focus on moisture and calm care. Always patch test and always finish with moisture and sun protection. And keep meals balanced with water, vegetables, fruits, protein, healthy fats, and fermented foods. A final note for safety. This talk is general support for healthy living. The best plan varies with your own skin, your medicines, and your medical history. If a spot changes size or color rapidly, or there is bleeding or strong itch or pain, do not wait and seek medical care. When you try a new product or mask, start small and observe. Respect the small signals your skin sends you. Now let us deepen understanding with a simple look at structure. The skin includes the outer stratum, corneum, the epidermis beneath it, the dermis, and the fatty layer. The stratum corneum shields us from the environment, and the pigment cells live in the epidermis. In the dermis, collagen and elastin weave a network to support firmness with age. Collagen production slows and existing fibers lose resilience, so fine lines and sagging appear. Ultraviolet light accelerates this by stimulating pigment cells and harming elastic fibers, which is why daily protection matters. Key points for age spot recovery. Do not pick at the surface. Do not repeat harsh scrubs. Avoid touching healing areas. Delay hot baths and saunas while a crust is present. Use prescribed ointments and moisturizers exactly as directed. These simple basics can change how quickly you heal and how little marks remain. For melasma, your daily rhythm is powerful. Avoid the strongest sun hours and choose shade. By a window, use curtains or protection for long sessions. Ease activities that spike facial heat. Before sleep, rest your back against the wall and practice slow breathing as tension softens facial. Warmth settles and color changes calm down. When selecting skincare, less can be more. Choose a few low irritation products that focus on hydration and soothing and use them consistently. Do not apply a new product over your entire face right away. Test a small amount behind the ear or along the jaw for a couple of days, then widen the area. Your cleanser does not need extreme foam. The heart of care is brief. Gentle cleansing followed immediately by moisture. Small techniques can lift the effect of home masks. Begin while the face is still dewy after cleansing to reduce friction. Do not rub from the outside in. Instead, gently press with the palms to settle the product. When rinsing, do not scrub with a towel. Loosen the mask fully with lukewarm water, then pat away the water and apply a hydrating cream at once. Let us make the food guide more practical. Build a plate with several colors at each meal. With green vegetables, include both leaves and tender stems. Cook orange vegetables, so there is still a bit of bite for satisfaction. Plan your week so fish and legumes appear regularly. Enjoy a small handful of nuts slowly, rather than a large portion at once. Keep sweet treats for special moments so everyday balance is easier. Do not forget hands and neck. We often care for the face and overlook the backs of the hands and the neck. These areas reveal the sun's record earlier before going out. Apply sunscreen to hands and neck after washing. Follow the same moisturizing steps as for the face. Before sleep, apply a generous layer on the backs of the hands and slip on cotton gloves for a softer morning feel. Know the safety signals. If a spot enlarges quickly or its edges grow uneven, if the center breaks easily, or pain and bleeding return with touch, do not decide alone and visit a clinic. Even long-standing marks that suddenly change in color, whether darker or paler, deserve evaluation so you can rest your mind. Your attitude reaches your skin. Do not look at your face only with a critical eye. Acknowledge the years it has protected you and choose a small action you can do today. A single harsh attempt cannot beat 1,000 gentle habits. Choosing to care for yourself kindly today changes tone and texture over time. Here is a simple daily routine. In the morning, cleanse briefly and gently, then layer a light hydrating product and a moisturizer and finish with sunscreen. During the day, reapply protection when needed. Keep a small cup of water in sight and take a few sips often. In the evening, remove dust and sunscreen slowly and moisturize right after washing, before sleep. Breathe quietly in a calm room and loosen the neck and shoulders. Even this can lower facial warmth and the skin begins to find its own balance. Please keep safety first today as well. Rather than chasing quick change with strong methods, build steady change slowly and lastingly through stable habits. This path suits mature skin. Best, I will stay beside you to help your choices be safer and more comfortable. Thank you.